Healthcare is back on the front burner. That's according to President Bola Tinubu at the launch of an initiative to renew the health sector in order to advance universal health coverage in the country. The sector also signed agreement between the federal government and state governments alongside development partners to drive the nation's commitment of improving the healthcare outcomes of all citizens, especially the vulnerable population. The Federal Minister of Health is expectant that between 2024 to 2026, at least $2.5 billion in pooled and non-pooled financing will be channeled towards improving primary healthcare system, as strategic steps will also be taken to effectively implement the National Health Act of 2014. Coordinating Minister of Health and Social Welfare Professor Mohammed Ali Pate joins me now on the program for more on this development. Honorable Minister, thank you for joining us on the program.
Thank you for having me.
Indeed, the Renewal investment initiative is largely considered a bold step in the journey to universal coverage in the country. But break down for us the collaboration expected between the federal and state governments alongside development partners to make this happen.
Yes, thank you. I think it's very clear that the President's Renewed Hope agenda has a vision for a prosperous country that has the health and well-being of its people at the center of that. And in that context, the national consensus to invest more, invest better on the health of Nigerian citizens is what the President has been able to do by helping construct this compact between the federal government and the states and our development partners to invest in the things that will make a difference for our children, for women, and for those who are ill or vulnerable in our population. That is what was signed yesterday at the banquet hall of the State House. And it is a new beginning, I will say, in terms of where we go from here to execute in improving the infrastructure, the equipping, the systems, the human resources at the front ends, so that Nigerians experience a different reality in the period ahead as part of this administration's overall direction.
Indeed, Prof, you know, they say no country has achieved universal health coverage without substantial mobilization of domestic resources. And we've heard a lot about the allocation of increased funds to the health sector in the proposed 2024 budget. But is there a plan to meet the 15% budget allocation target set by the African Union some 22 years ago, perhaps in the lifespan of this administration?
So there is need for us to use what is available to get more health for the money that is being spent, but also to add more in terms of more resources for the sector on our way to the goals that had been set previously but not met. What the President did this year was to increase the allocation from 3.68% of the federal government's budget to 5%. In the proposed appropriation for 2024. Now, it will take the federal government's investments alongside the state governments, complementing the federal government. And of course, given the circumstances that we have fiscally, our development partners also chipping in. But as we move in that direction, as we get more health for the resources that will be spent, I believe that the momentum will grow in such a way that we'll get closer to the aspiration that has been set. But it's not going to happen overnight. It's a major shift that has occurred in 2024 proposal, where we're seeing health getting significantly more, and that resource that is available now will be channeled towards the front ends, so that Nigerians will experience an improved health sector, whether in the physical infrastructure in the teaching hospitals, or the primary healthcare centers that are refurbished, equipped, or the training, retraining of the frontline health workers, of which we propose to retrain about 120,000 frontline health workers over time, so that they can engage with citizens and deliver basic healthcare services, antenatal care, stillbirth for women when they come to deliver, treatment of basic ailments like malaria, pneumonia, and other communicable diseases that are becoming more prevalent in our society, like hypertension, diabetes, and many of those that can be addressed at the primary healthcare level, so that we can decongest the higher level health facilities, the teaching hospitals, to focus on the more difficult specialized care. So with that arrangement, and if the states come with us as they have signed the compact and complement what the federal government is doing, and we're very confident, given the huge political will that they demonstrated in tandem with the direction that Mr. President has set, that Nigeria will begin to move closer to that aspiration for an improved healthcare system.
Well, counting on that as well, government has also been talking about a comprehensive revamp of physical infrastructure and equipment. You have also talked extensively about training of frontline healthcare workers starting from next year. But let's talk about the basic healthcare provision fund for a bit. There were plans by the previous administration to refurbish some 10,000 primary healthcare centers across the country. With the launch of this fund and the inauguration of the National Health Act Steering Committee, much of those facilities are reportedly still non-functional. How has this been redesigned for better results? And, Nigerians are also interested to know whether you are willing to probe the monies disbursed last year.
So the Basic Healthcare Provision Fund has 1% of Consolidated Revenue Fund. That is from the federal government portion of the resource that we have. That it's to be channeled towards the primary healthcare system, working with states and local governments. In the last few years, attempts have been made to revitalize the primary healthcare centers. But we have 24,000 primary healthcare centers in Nigeria, and not all of them are functional. In fact, less than a third of them are fully functional. With this revamping, with the Health Sector Renewal Investment Initiative, what we're seeking to do is to deploy the resources in the Basic Healthcare Provision Fund in a targeted way to make more of those facilities fully functional so they can provide as much of the services that are needed to be provided at the primary healthcare facility level. And with the complementary resources from our development partners, expand the reach of what the BHCPF itself is able to address, and expecting that states will provide their own counterpart contribution, sometimes in kind or in cash, so that we stretch the resources of the federal government to get to the target in the next 4 years of at least 17,000 of those facilities, which is more than 2/3 of what we have in our country, so that women, children, disabled, the elderly will have the basic healthcare needs addressed, and to decongest the higher level health infrastructure in our teaching hospitals or some of the secondary health centers. I think if you go to many of the teaching hospitals today, you'll find that there are many cases, such as malaria cases or basic walk-in pneumonias, that could have been addressed better and more efficiently, more cost-effectively at the primary healthcare level. But because the primary healthcare level has not been as functional as it should be, they all find their way to the higher level facilities and congest them. So that's one aspect. The second aspect is looking at the Vulnerable Groups Fund, which is providing cover for the poorest Nigerians to access healthcare, to afford the cost of healthcare. So far, less than 2 million Nigerians have been able to access that. And while that is not insignificant by itself, we expect that to refine that, to target the poorest and most vulnerable, and as resources become more available, to expand the coverage through that and implement the mandatory health insurance that was provided for in the National Health Insurance Act of 2022, so that the affordability of healthcare gets improved. Beyond that, we need public revenues to be raised to be channeled towards health. And in the compact that was signed, I think there is appetite from states to look at innovative financing arrangements, whether it's in terms of surcharges like telephone calls or airline tickets, or even looking at some pools of revenue like the VAT pool to see whether health can get some allocation that can provide coverage for the bottom 40% of Nigerian population in terms of income, so that we stand with those who are weakest, most vulnerable.
So when you talked about plans to double the number of fully functional primary healthcare centers, I think you gave a figure of between from 8,000 plus to 17,000 plus, correct me if I'm wrong, in 4 years. When you say fully functional, what does that really mean? Are you suggesting that there are 8,000 plus primary healthcare centers across the country that are operating optimally with adequate facilities and qualified personnel?
The first set within that 8,000, the previous administration tried to revitalize. I think they did about 3,500. And some of those will look at them to see whether they are fully functional. So our first goal will be to get to the 8,000 and then double over 4 years. And it's an incremental process, but at least we've got that target. And that the accountability framework that has now been concluded through this compact allows us to track the progress transparently and make it visible to the public, to our partners, to the state government, and to Nigerians overall in terms of the progress that we're going to make it. Now, it's very audacious that we're saying that we're going to do this and be visible about it because we think it has to be done for Nigerian health system to improve the way we want it to. So I think the commitment we made is not done lightly. And I do believe that Mr. President is extremely serious that he wants the health system to be transformed in a way that serves the health needs of Nigerians. And that is what we are committed to do. And together with the state government and our development partners, we've now signed the compact. In other words, we are now all pregnant. We have to deliver on this commitment that has been made.
How precisely with this investment initiative impacts significantly on the number of Nigerians captured within the National Health Insurance Scheme, which we understand is still quite below the 10% mark?
Yes, for Nigeria's journey in health insurance has been a very long one. It's more than 20-something years in the making. It's been slow and arduous. 2022 was a landmark with the National Health Insurance Authority Act that was passed and signed into law that made health insurance mandatory. Now, there are elements of that that will have to be executed alongside the state health insurance authorities, and we'll need to look at the guidelines for operationalizing that law. But at the core of it, there needs to be more public revenue to target the poorest and most vulnerable, and we need to raise those resources. And in the context of this effort, the BHCPF will contribute to the Vulnerable Groups Fund, but it goes beyond what the BHCPF provides. It's not enough by itself to get to the target. So innovative financing will have to be considered. And I had mentioned some of those that I believe the state governments are also showing increasing appetite to look at that. And we are putting some resources from the federal government side to add to the Vulnerable Groups Fund so that all of those will add up to more people having affordable access to quality health care over time. It's not going to be overnight, because if it was going to be easy, it should have been done over the last 20 years. It wasn't. But here we have an administration and a president who is committed before the elections and after the elections in terms of doing what is necessary to make healthcare more affordable, especially for the poorest and most vulnerable Nigerians.
You know what, Prof? We decided to open this conversation to our viewers and ask them to send in some questions they have for you using the hashtag Beyond 100 Days on X, formerly Twitter. One of them at Chem Patriot is asking, what are your plans for universal health for all, where citizens can subscribe at a fee that doesn't hurt to enable them access healthcare whenever and wherever in Nigeria? And she's saying, is there a way to end or extremely minimize out-of-pocket payment for health services?
The way to do it is to expand health insurance coverage. And the Health Act I mentioned provided for mandatory coverage by all employers, but also for private health insurance through the HMOs, so that individuals can subscribe and be able to get the coverage for the service that they're in need of. From the public sector side, we're looking at the basic package, a refined basic package that is affordable. Before now, most of the analysis, the costing of that package, the composition of that package has been many years and many parameters had changed. So we're going to refine that so that an affordable basic package is available and individuals can overlay on top of that with private health insurance if they need, so that when they require sophisticated healthcare, they can be able to have that more affordably. That is the step, one more step, advancing Nigeria's move towards universal health coverage. It will take time. And just to say that the UHC aspiration is one that all countries in the world have agreed to, but many countries are still struggling to get there. But we're seeing Nigeria now coming together between the federal government, states, development partners, and citizens, saying, look, we need to move faster in that direction. And I believe that you will see incremental progress, and even beyond incremental progress, significant progress, if all of us agree to subscribe to the health insurance efforts.
We're looking forward to that. There's an interesting one here from Adegboyega Abiola, who says, what are the plans you have in place to ensure that we have facilities here that will deter our public office holders from traveling abroad for medics? And, you know, they say rich men can trust doctors here to treat malaria, but when it comes to terminal diseases and illnesses, they fly out. How do you react to that?
So in the proposal for our 2024 appropriation, again, thanks to Mr. President's leadership and direction in revamping, renewing the health sector, you're going to see federal government investing significantly in the infrastructure for cancer care in the 6 geopolitical zones. The physical infrastructure, but the equipment for cancer care, such as linear accelerators. People don't have to travel to other African countries or to the Middle East or Europe to have care for such devastating and high-cost illnesses like cancer, which is unfortunate for anyone who is affected. So that's just one element. We're going to see revamping of the physical infrastructure and equipment in many of our teaching hospitals, our federal medical centers, and our specialty hospitals. You're going to see retraining of our healthcare workers so that they are tooled, they are retooled, skilled to deliver higher quality care. You're going to see partnerships with the private sector in terms of the infrastructure for delivery of health services. We're discussing with some high-end, in fact, one of the best healthcare providers in the world. I wouldn't mention the name here, to bring to Nigeria a service line on cardiovascular care. So you are going to see creative, innovative public-private partnerships that will expand the availability of health services to Nigerians. We spent $2 billion in outbound medical tourism. If we can have the infrastructure and the private sector participation, some of that $2 billion from those who can afford it can be spent here, will create jobs, will return economic value, and will be providing opportunity for us to even retool, skill our healthcare workers so that they can do more. And there are many Nigerians abroad who, with the right infrastructure, I believe will be willing to, in fact, bring those skills and serve here in our own facilities. That's a journey that we are committed to, but it will take all of us. It will take the government and what the president and his administration is doing. It will also require others to complement that. And here the states also have a role, as well as the private sector has a role. And all of us are the ones that will change this direction and this narrative for Nigeria's health system to make it better.
All right, finally, let's talk about what happens now, even before the passage of the budget and the implementation of its content. For instance, take the diphtheria outbreak in Nigeria, where Kano has the highest burden of the disease, and, you know, the huge number that we have recorded in the past months. How do we use what we have right now? You talked about the primary healthcare coverage earlier, to fix this challenge, and what is government doing differently?
When we came to government, we found several months, I think at least 9 months, of a diphtheria outbreak in Nigeria, mostly from children who had missed vaccination in some of the states affected. We went into action in September of 2023 and set up an emergency task force comprising the Primary Healthcare Agency, NCDC, our development partners, and the state governments. And since then, expanded the outbreak response, provided vaccines for the appropriate for dealing with response and provided revamped supplies for the treatment of those who are affected. The diphtheria outbreak is much tamer now than 2 months ago in September, when it was raging in many states. We're not yet out of the wood, and it's also not exclusively a Nigerian issue. There are countries in West Africa and even in Latin America that are suffering from this outbreak, partly because the pandemic that we experienced over the last few years disrupted the delivery of vaccination all over the world. But having said that, the emergency task force that we have here has tracked, and with the partnership with the state governments, we've seen more and more children basically catching up, getting immunized, and those who are affected being treated, so that the outbreak that we're having is beginning to turn downwards, and we expect that we should get to the bottom of it. The key lesson there is that every child should have access to safe, effective vaccines against vaccine-preventable diseases like diphtheria and measles and others.
Quickly, Honorable Minister, I know there have been called for medical professionals who have left for greener pasture to return. But is there a sense to which this investment initiative plans to retain more of medical professionals rather than the outflux that we've witnessed in the past years?
I think we'll appreciate those who are staying first. There are tens of thousands of medical professionals all over Nigeria that are working hard, sometimes in difficult circumstances, at risk to themselves, delivering services, and are not packing their bags to leave the country. And we appreciate them. And there are many more of those than those that are leaving. Now, for those who are leaving, they're leaving for various reasons, sometimes to train, sometimes for family reasons, or for whatever reason they are leaving. We hope if they leave, they will learn a few things and come back. And for those who are there, I know that there are many Nigerians in the diaspora, in the United States, in the UK, and many other parts of the world, who have remained engaged in this country and are finding ways to contribute, whether through medical missions, through research collaborations, and many other ways that they can come back and contribute. As we revamp our infrastructure, I'm confident that we'll see more Nigerian physicians abroad willing to come. I've got few friends from the United States, for instance, who are very willing. They've got successful practices, but willing to come back with the enabling environment that this president is actually putting on the ground. And that is what many professionals, whether physicians or other cadres of healthcare workers, are looking for. And we're confident that over time, we'll convince more and more of them to come back and contribute here at home.
Well, welfare, remuneration, condition of service are some of the reasons why they are leaving. But hopefully, we're counting on the promises made with this Renewal investment initiative, and we're looking forward to how much impact it will make. Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, thank you for talking to us.